Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, in the slow viral disease or prion disease, one of the important prion disease is subacute sclerosing panencephalitis. Subacute sclerosing panencephalitis can occur as a chronic complication of measles virus. It has a delayed onset, and the outcome of subacute sclerosing panencephalitis is, in most of the cases, it is fatal. As the name says, it is a slow viral infection, and it occurs mainly, it is believed to be as a persistent infection with an alternate measles virus. Whenever there is persistent infection with alternate measles virus in the CNS, this can result in subacute sclerosing panencephalitis. It is believed like that, but actually it is a complication of measles virus, and it is a progressive disorder, obviously, and it is characterized by, here there is demyelination of central nervous system occurs in subacute sclerosing panencephalitis. Right. In subacute sclerosing panencephalitis, we have different stages. Among that, stage 2 is important, where we see massive myoclonus is characteristic of stage 2 subacute sclerosing panencephalitis.
thank you and thank you for watching.